Hi, Dr. Corey Maas on Looking Your Best. I have a patient that has wrinkles under the eyes, we call dermatochalasis, a lot of facial aging changes, but was really concerned about those lines under the eyes and then the little curtains or the perioral lines around the mouth. So I thought I'd take you on a little tour of what we're going to do and how we're going to do it for treating with fractional laser resurfacing for little lines around the mouth. So come on in, let's take a look. I'm just going to start with some little tiny numbing shots here. I have an alcohol wipe. And then you just lift your chin way up for me. And I'm just going to go right around, and this will numb the area around your eye. And we're going to do around the eye and then a little around the mouth too. There's a little mental nerve, they call it. I once did a mental nerve block and the lady said, well, when can I be able to think clearly again? It's not really your thinking mental nerve. It's that's the name of the little nerve that supplies your lower lip. Comes out of a little foramen there, little hole by the bone there. And so I'm gonna do a little bit for your lower lip here, and it's just a series of little drops here that I'm going to be giving you. I've got in the memory, I've got it set up so that I have sort of presets that I use for treatment, and I'm for lower lid's going to do a modest power setting, and I do a single pulse with each step. I can turn that on and off, and the density, I'll go a little more density because she's got pretty good wrinkles, so that's going to be for the eyes, and I'm going to step it up a notch for around the mouth. And really that's the deep FX. So the deep FX is 300 hertz, 17.5 millijoules. You can use different sizes of shapes, but this is a good one. And important to remember that this is a 0.3 millimeter or 300 micron dot of thermal injury that I'm going to generate when I do the deep FX. And in the patterns I've got it only 20% coverage with 300 microns being the diameter of the area of thermal injury. So with each little pulse here that I lay down, and this is a grid pattern of about 8 millimeters square, but if we looked on a really microscopic level, we'd see that there are really tiny little holes or little tunnels of thermal injury that, based on my setting, are going into the dermis. Feel that little stinger? Okay, I'll get away from that area. And with that little area of thermal injury, getting something like that, the body is responding, and it's responding by making new skin cells, by stimulating collagen, that the collagen producing cells, the fibroblasts that live in the dermis, the second layer of skin, and so they're making new collagen, and they're also stimulating the remodeling and the reorganization of the existing collagen layer that's already there, which as we age it gets all tangled and matted up, so it doesn't look like young collagen. It's all nice even bundles that are evenly distributed, and that's what gives our skin all its elasticity, is these nice even bundles of collagen that are laid side by side, almost like the wires in a electrical cable. And then as we get older, these little bundles or fibers get all tangled up, and that's how skin, at least in part, that's how skin loses its elasticity. So I'm not overlapping, and what really can't be seen with the naked eye is that along with this scanning pattern, these are only the little tiny dots that I'm, if you will, drilling using the laser into the skin, are only 300 microns. That's 0.3 millimeters. and there's 24 millimeters in an inch. So it's 0.3 or 1/3 of 1/24 of an inch is the size of the diameter of the holes. And now the handpiece is connected, the section's hooked up on this. And this one's a little different in that this particular handpiece, as I turn it on, is going to have a larger spot size, but more importantly, when I shoot the device, I'm going to be shooting it in a way that has a much more superficial or scalloping type of injury rather than a deep drilling injury, and one can see the pattern that I'm going to be shooting in. I can make this larger or smaller, and I'll take a tongue blade, please. And then I always check with the tongue blade to make sure the pattern is correct. So if you look at that pattern, I separated them. You can see that there is a pattern to this. If I keep it real still and square, they're laid down not in even rows, but in uneven patterns. So that's the principle. And these are much wider dots. If we looked at the other machine, you'd see that the dots were much closer together. And at the end, we're going to have you cooling your skin surface. Feels a little bit like a sunburn. But as the local wears off, that sunburny feeling will go away. Literally see the skin contracting there as we do it, which is nice because the collagen contraction is a big part of this. 1, 2, 3. So that's the whole treatment. Our instructions after we do the treatment are pretty simple. We're going to put some biofine on here, which is a special medicine that we have or topical that we will use immediate post-operative period. And that is, I'm taking your little contacts out.
It's my pleasure to answer your questions. You can find out more information at maasclinic.com. You're certainly welcome to either send videos, photos, or just questions to our video blog at drmaas.com, and I'm happy to answer those questions. As always, Dr. Corey Maas on Looking Your Best.